I took out those things and I did my food allergies, and as soon as I got all that out, psoriasis went away. And I'm talking 34 years of psoriasis and now none. Hey guys, Dr. Kyle Loveless here. Today I want to answer the question for you, why do you have psoriasis? Okay, psoriasis is actually a skin condition, causes flakiness on the skin. And really I'm going to talk about psoriasis and eczema, and they're just inflammation on the skin level. And the one thing I do know is that if you have psoriasis, if you have eczema, that it affects your life on a daily basis. It causes pain, it's itchy, it's embarrassing. It's something that actually affects the clothes you pick out every single day. And it's something that if you have psoriasis or eczema, you've probably been to a dermatologist, you've probably been to different doctors who have given you steroid creams, or even worse, maybe even steroidal medications that you have to take internally or orally. And those things wreak havoc on the system. Okay, and so I want to look at eczema and psoriasis today and answer the question, why do you have it? Why is it happening in your body? Personally, I know all those things that you're experiencing because I had psoriasis for most of my childhood and most of my adult life. It wasn't until about 3 years ago that it completely disappeared for me. So I've experienced that, I've used the creams, I've used the medications, and I know that it is something that has a huge impact on your overall life. It affects everything that you do. So with that said, let's figure out an answer. Instead of just going to the doctor and taking medications for the rest of our lives, let's find out why your body's producing it. So I always like to turn to one of the top medical sources whenever I'm looking at something like eczema or psoriasis and see what do they say about it. So I got this right here. I have the Mayo Clinic. And here's what the Mayo Clinic says about causes of, let's start out with psoriasis. It says this, that psoriasis is thought to be an immune system problem, and we'll have this posted on the video, but an immune system problem that causes the skin to generate at faster than normal rates. It's the most common type of psoriasis. Okay, we're talking about plaque psoriasis here, known as plaque psoriasis. This is rapid turnover cells, results in scales and red patches. Okay, so what causes it though? Just what causes the immune system malfunction isn't entirely clear. And that's where the investigation has to come in. So they take it at a different level, and they say researchers believe both genetic and environmental factors play a role. The condition is not contagious. So the approach medically is, how do we stop that cell reproduction? How do we stop that immune response? And just like any instance where they're trying to decrease inflammation, or they're trying to decrease that immune response, they give you something that will block the immune response. And it might be a steroid, it might be Remicade, it might be some sort of injection, but ultimately what they're trying to do is block the immune response so that the symptom will go away. And so the problem is they're trying to change the skin, they're not trying to get to the root cause of the problem. And so if they give you that medication and your skin clears up, for me, growing up, I would have psoriasis, I would put the cream on, it would go away. But to be honest with you, I didn't want to put cream on every single day, one. And two, as I got older, I learned that those steroids were actually very bad for my body and my immune system, for the digestive system. And so you don't want to take those every single day, but that's kind of the answer. And then if the skin problem goes away, your eczema or your psoriasis looks better, then they say, okay, we did a good job and that's what you're going to have to do. But they never really figured out why. Right? So why is your body creating an immune response? One of the other things we know about an immune response that's chronically happening is that chronic immune responses or infections can actually lead to things like a depressed immune system causing cancers. Whereas acute immune responses and infections can actually increase your immune system. So getting a virus or a bacterial infection that your body fights off is actually a good thing, whereas something like this is a bad thing long term. And so the other one I looked up is eczema. So this is Mayo Clinic again. It says eczema is related to gene variation that affects the skin's ability to provide this protection. Healthy skin helps retain moisture and protects from bacteria, irritants, and allergens, and eczema kind of blocks that. This also allows your skin to be affected by environmental factors, irritants, and allergens. In some children, watch this guys, because we're going to talk about this, in some children, food allergies may play a role in causing eczema. I would 100% agree with that. And that's why I love the Mayo Clinic. They still have a medical approach, they still have a medical look at things, but when they look at like what's causing things, they really do have some good stuff on there. And so I want to come to that approach is, why is that happening to you? Well, the only way to truly know is to investigate and find out why. To do the proper testing. See, is there food allergies that you're eating? I know for us, and the first story that comes to my mind is a patient. I'll just kind of make up a name instead of putting her name on the video. But it's a little girl, and let's say her name's Ellie. And she came in with eczema on her feet. Really bad scabby eczema. We'll actually post the picture, before and after picture on the video here. But really bad scabby eczema. And the doctors pretty much just would give medications and no other advice. Well, I told her mom, I said, hey, let's start right off the bat. Let's get a food allergy test immediately. These are the 3 things I'm gonna tell you to do right now if you have eczema or psoriasis. And this is what I told her to do, and it worked within 2 weeks. She started to see changes on this. And so the before and after pictures I'm showing you are within a 3 to 4 week period of time. And so I said, take out gluten and take out dairy, take out soy and corn. Okay, now that might seem like a lot. If you look at most of the food in America in the grocery store, that's about it right there. So you're gonna have to take out a lot of the processed foods. I also told her, let's do a food allergy test to find out what foods are causing her body to create that inflammatory or immune response. Okay, and then if that wasn't all, if we need to do more, we could go into gut testing and other things, but for her, that was enough. We got her food allergies out. She quit eating those foods. She started to reduce some of the sugars as well. We got her on a few little supplements after that, but really it was getting the food allergies out, a good food allergy test, and taking out gluten, soy, dairy, and corn. And for some people, they feel like it's almost impossible to take those things out, but I can tell you for myself, that's what worked for me as well. I took out those things and I did my food allergies, and as soon as I got all that out, psoriasis went away. And I'm talking 34 years of psoriasis and now none. So it does work. And now I have also had patients, I'll say this because I'm not someone that likes to say everything's the same for everybody. I've also had patients where we've done that and it didn't go away. Doesn't mean it wasn't the answer. It means there just might have been more to the situation. And so we continue to investigate. We ended up doing a stool test, finding out they had some yeast development in their gut that we had to take care of. We gave them things like organ grape, which, by the way, on Mayo Clinic, one of their alternative therapies that you can do for it, not medications, but alternative things you can do for eczema, is organ grape. So it's an awesome herb. It has berberine in it, and it is amazing for killing off yeast, but it's really great for eczema. Okay, so truly the answer, when I say why do you have eczema, the answer is you have an immune response. Or why do you have psoriasis? There's an immune response happening in your body. Why? Well, we're gonna have to investigate. We're gonna have to find out why, or you're gonna have to investigate, but you can start by taking out gluten, taking out dairy, taking out soy and corn products, and get a food allergy test. And if that isn't the full answer, then you find a good practitioner, someone like us at Queen City Health Center, and you find out what else do I need to do, and you have someone help track you along that process, and eventually your body will heal itself. But if we don't do anything but just take the steroid, then you're stuck in that constant negative immune response, which you don't want to have. All right, so hey guys, if you want to learn more about psoriasis, about eczema, or just inflammation in general, we'll have a link down below to our ebook on inflammation, and you can simply click that link, get the ebook, and learn so much more about your health overall. You guys have an awesome day.
Hey guys, thanks so much for watching this video. If you want to connect with us and learn more, we're constantly shooting information or shooting videos. We actually have a blog as well, and we have a website where you can learn so much more. If you want help with your health, you can actually connect with us, come into our clinic, or jump on a phone call with us and see if we can help you. To do that, go to the links below in the information area and click those areas, and then you can move forward and see how we can actually address and help you with your health issues as well.